security breach as well. On to a major medical story now. The FDA is warning anyone who takes painkillers, cold medicine, or any other drug with NSAIDs that you may be taking a bigger risk than you realize. Bottles of ibuprofen, Advil, Aleve, and other over-the-counter NSAIDs have long warned they might increase the risk of heart attack or stroke. And now the FDA says those drugs do increase your risk. One agency doctor's warning, quote, everyone may be at risk, even people without an underlying risk for cardiovascular disease. Drugs taken by millions, more dangerous than first realized. Joining me now is Dr. Dan Simon. He is a cardiologist at the University Hospital's Case Medical Center and also the president of the Harrington Heart and Vascular Institute. Doctor, thank you for being with us here to put some perspective with this. And let's do that with some numbers. In 2013, Americans bought more than 275 million boxes of over-the-counter NSAIDs, totaling about $1.7 billion in sales. So how alarmed should we be about this?
Well, I think we really need to be very careful about being alarmed today. We've had patients calling us since early this morning. I think it's very important for reviewers to understand that the absolute increase in risk is very, very low. So the NSAID Trialist Collaborative from Oxford published really the definitive paper on this in 2013 in Lancet. They looked at 250,000 patients in nearly 75 studies. And what we learned from this observation is that the risk indeed is quite low. There are about 3 excess events per 1,000 patient years of use of the drug. The excess risk, the absolute risk, is really quite low and is largely restricted to patients who take high-dose NSAIDs. So that's 2,400 milligrams of ibuprofen, 1,000 milligrams of Advil, or 150 milligrams of diclofenac. In fact, it's been said that 99% of the episodes of increased risk occur actually in that very high dose group, and that's far higher doses than the average patient uses in a given day. Okay, so short of really counting our intake here, the FDA, they posted an explanation about NSAID on its warning on its website saying, quote, today we know that the risk of heart attack and stroke may occur early in treatment, even in the first weeks. There is no period of use shown to be without risk. So with that in mind, for those of us who just want some pain relief here and there, what kind of caution, how do we go about in doing that, and how much caution should we consider? Yeah, I think that's a great question, and I would say the following. First, of course, is that one can try to use non-NSAID pain medications like Tylenol. That's always a good approach. Physical therapy, local applied topical medications can be useful. It's really worth a conversation with your doctor. We believe, and we certainly have been telling our patients, that the isolated use of low-dose NSAIDs, such as Aleve, 220 milligrams twice a day, is low risk, and certainly lower risk than I think would be suggested by the FDA advisory. I think many of us are very concerned by the advisory. It's very important to point out to your viewers that this is not the result of a new study that just came out. This arthritis advisory group was convened in February of 2014. The largest definitive study that I cited was published in Lancet in 2013. This is a reinterpretation of the data by a limited advisory group, and I think it's very important to stress to your viewers today, please contact your physicians. Don't be alarmed. The absolute risk is low.
All right. Cardiologist Dan Simon, thank you very much for that.
Thank you.
The controversy over the Confederate flag is still alive and well, and